All right, let's then cross to Durban then, where the Deputy Minister of Health, Dr. Sibongiseni Dhlomo, is officially opening the 7th South African TB conference in Durban.
Challenge. We will nevertheless continue to strive to prevent, control and treat TB through various strategies and interventions that are creative. This includes training and research activities as well as a TB HIV integrated approach, which is an integral part of our response strategy. Our TB programmatic response is guided by the National Strategic Plan for HIV, TB and STIs of 2017 to 2022. Its chief aim is to achieve the national 90-90-90 targets for TB as outlined in the Stop TB Partnerships Global TB Plan, as well as the national TB strategy for finding TB missing cases. We will continue to offer greater laboratory coverage for Gene Expert Ultra and microscopy, which is available in all our hospitals and community health centers. Again, we need to get more mobile units that we will take to our different rural areas. In conclusion, as the province of KwaZulu-Natal, we remain committed to turn the tide against TB, HIV and AIDS, and by doing the following, among other things. 1, strengthening case finding in and beyond healthcare facilities, placing greater focus on TB prevention for people living with HIV, particularly earlier initiation and scaling up of antiretroviral therapy, and scaling up continuous TB preventative therapy. We are of the firm belief that in 2022, even as a developing country, we should not continue to be held hostage by a disease that is preventable, treatable, and curable. We therefore welcome the gathering of the heads in this meeting at this South African TB conference to seek practical and sustainable solutions to reversing the tide of TB now and forever for the benefit of posterity. With those few words, ladies and gentlemen, please allow me to introduce the Minister, the Deputy Minister of Health, Dr. Sibongiseni Dhlomo. Dr. Dhlomo is currently Deputy Minister of Health, but was an MEC for Health in this province of KwaZulu-Natal from 2009 to 2019. So he served his 10 years. He's a former member of Umkhonto weSizwe and was incarcerated in Robben Island in the 80s. He holds an MPCHB from the University of Natal, BA degree from UNISA that he acquired while incarcerated on Robben Island, Masters in Public Health from Medunsa. He has quite a number of diplomas, colleagues, that are in relation to the health element, and he had continued to actually enrich himself. The recent diploma that he received is on forensic pathology from the College of Medicine in South Africa. He has also served in the South African Defence Force and worked as an academic at the University of KwaZulu-Natal, lecturing in public health. Ladies and gentlemen, please let's welcome Dr. Dhlomo to the podium.
Thank you very much to my colleague, MEC Simelane. The part that we are not aware of, that she's today an acting premier. Now, she would then, on our behalf, pass our thanks to the premier, who is a female, and decided to send an acting premier who's a female in a land of Umtania. We are actually happy to be in a Umtania land. Umtania is a female, so as men we have no problem to be led by females, and in fact must give females a space, because you always said, can she lead? You can never know until you give them space to lead. Only then you can be able to tell that they can lead. To our chairperson of this committee, of this conference, together with your organizing committee, we are very grateful about the work that you have done. Thank you very much. To my colleague, colleagues, Mama Regina Howle from Basic Education, who is not only here to be part of us, but has been here in this province for some days. Thank you for your impact that you have done to schools and to those communities that we have visited. My colleague MEC, Mama Henrietta Bohopane Zulu, she also is in and out of this province, doing many things, good and bad, but she... But we are always grateful that you are in our province. Makoti wa like the province lo esingayla. MEC Manzini from Mpumalanga, colleague that I also worked with as my colleague MEC similarly mentioned. I once spent some time with them in National Health Council as an MEC. MEC Sambata, who is also somewhere hiding. I haven't seen him close, but we are informed he's here. Members of Parliament who are here and members of the provincial legislature who are also part of us. I do notice that amongst us there's Honorable Viola Motsumi from Northwest. She's a member of provincial legislature, but they're serving as the deputy speaker. We are very grateful to have you here. I know there's a special lessons you are going to teach us on that satellite site of a TB caucus by members of Parliament. To all the distinguished guests that are here, my comrade Steve Letsike, Ms. Steve Letsike, who's a co-chair of SANAC, in the absence of the deputy president, he's always looking at us in a way that is telling us, I'm watching you. Now, we have to behave in her presence because it's like the deputy president is here with us. To all our leaders from various provinces, Department of Health has sent EDG here, with Dr. Buthelezi, HOD, I've seen HOD, Dr. Shabalala and other HODs I might not have seen, HODs of various provinces, members of the civil society who are here, leaders from various provinces who are leading in provincial aid councils and also who are TB ambassadors, the fellow South Africans who are here, ladies and gentlemen. I might not have completed the list, but for all of you, thank you very much. I'm also adding a welcome to yourself, having actually been started by our Honorable Speaker of eThekwini, Ubaba Unyawose. Thank you very much for your words of welcome, and also echoed by our acting Premier, Mayor Simelane, Nomaku Simelane. I would like to actually indicate to you that the minister had wished to be here in person. Unfortunately, he's attending a cabinet meeting. Now, my colleagues, don't take this matter seriously and take it to our president, deputy president. I talked about an item of a cabinet before Minister Kungubele talks about it openly in the space that he's going to do. Among other things that is going to be discussed in cabinet is a bill that is coming in from health. The Department of Health, led by Minister Pasha with the DG Buthelezi, have crafted a bill, the bill that aims to have a control on tobacco products and electronic delivery systems, because we are very keen to see that that thing is streamlined properly. Thank you very much. Once that bill, which we are very hopeful Cabinet is going to support us, has gone through today's meeting, it will then go to Parliament and takes its route, like there's now NHI there. Hopefully by the time that portfolio committee receive this bill, they would be clearing up this portfolio, this NHI bill, and then tackle this bill that we so wish we could have immediately to really take on the strengths that former Minister of Health, Dr. Nkosi Dlamini Zuma, had. When many were criticizing her, what is she doing? We would want to tackle these issues of tobacco in the same strength and move on and see that maybe we can have a better world. That song that was actually sung here, we all are striving for a better world. What are we doing in health? We want South Africans to have a long and a healthy life. With all these pressures that we have, it's very unlikely. Now, it's a great pleasure, therefore, that today we are here to actually kickstart the 7th South African TB conference. Equally privileged to be here on behalf of the Minister to reflect on South Africa's TB epidemic and responses as we strive to recover from the devastating effects since COVID-19 pandemic. The last 2 years, almost 2 years and a half, have been very challenging for us in the country. We have seen many times and have heard many words where we have seen a capture of families by COVID-19, families, communities, and systems, including our health systems and in the world, where we have not been able to move on due to lockdowns and other pressures. Through a global commitment and collective action, we have shown that success against communicable disease threats is within the reach, despite our numerous social, economic, and political challenges. We need a sound research and a meaningful strides to improve the experience of our TB clients in keeping with the end TB strategy. I trust that all of us present here will keep to that commitment. Now, to date, COVID-19 has claimed just over 102,000 lives in South Africa. And between 2021, we have lost over 110 lives on TB alone. This is an average of about 301 people per day. Now, on average, this is almost about, if this was to be in the world news, they will be saying every day in South Africa there's a crash of a plane, if they were to talk about 301 people. But nobody talks about it because it is what? TB is one of those things that probably you can pay less attention to. Now, we as a country have a high burden of TB. And also, I was very excited to learn this from our speaker, that he knows this relationship between TB and HIV. And our speaker of eThekwini is also very happy to say, if we do not follow up those who are missing out on their treatment, then we are not really making an impact in terms of TB treatment. So we are very grateful about that, Babu Nyawose, because now it shows leadership. Not necessarily nurses, not necessarily doctors, leaders of the society saying this is what should happen if we have to actually make a very big dent on TB. Yeah, statistics are really showing that we have, while we have done relatively well before COVID, during COVID, globally we have seen an increase in the number of deaths on TB, and we wish to actually change that situation. This must stop, and we must actually improve. As a German philosopher Johann Wolfgang once said, knowing is not enough, we must apply. Willing is not enough, we must do. Close quotation. It cannot be business as usual, as also said by our co-chair of SANAC, Ms. Steve Letsike. Not anymore. Let us turn the gaze inwards and ask ourselves a few tough questions. History tells us that the solutions offered to difficult and complex problems are generally complicated, tedious, and sometimes timid. As a result, the problem gets compounded. I fear tuberculosis control may become a victim of this timid thinking and actions. Perhaps COVID-19 pandemic was a necessary wake-up call for all of us. History also tells us that the bold and audacious steps offer the greatest opportunity for success. For TB, this is our only hope. In the last century, smallpox was actually eliminated because we dared to dream big. Our forebears did that. As we are ready to dream big and bold for TB, we have no choice. For too long, we have let incremental progress lull all of us into complacency. The TB situation has been exacerbated by COVID-19, but now we are beyond that. As some of us are clinicians, I can tell you that we cannot address a disease unless we sufficiently understand its epidemiology and have data to effectively combat it. A basic question to start is, who does the disease continue? Why does this disease continue unabated despite remarkable biomedical progress we have had in the past decades? Now, maybe it calls on us, and I know my colleague, Regina Mhaule, and particularly I've heard this very vocal from Deputy Minister Henrietta Bogopane Zulu to say, Dhlomo, Kameni, don't think about only a biomedical solution. This disease is broader than just giving tablets. You are giving tablets to people who are in an overcrowded space, and therefore very unlikely that you will be able to have an impact. You are giving a TB treatment to people who are poor, and people who are malnourished, and people who are unemployed. You must address that comprehensively, because you may actually be shouting at some of the people why they are not coming to collect medication, but they just have no means to come to your facilities wherever they are. So those are things that we are beginning to learn, and some of us who are healthcare trained should then be appreciative that this has got social, political, and economic conditions that are making it not to be an area where we would want to go. So we should always be mindful of this. We cannot put any price in saving lives. Let us actually work hard to say there is nothing that will stop us in doing this. People afflicted and affected by TB are most of those who are probably coming in from these communities I've mentioned at disadvantage. That is why maybe one day Mama Teresa described them as follows, and I quote, "Hungry for love, he looks at you. Thirsty for kindness, he begs of you. Naked for loyalty, he hopes in you. Homeless for shelter in your heart, he asks of you. Will you be there to help him or her?" Close quotation. So these are some of the challenges that we do face, but I'm very delighted that under the leadership of Dr. Pasha, we have crafted, supported by DG, what we call a TB recovery plan. This TB recovery plan is a target-driven, evidence-based plan aiming at finding people with undiagnosed TB, strengthening linkages of people diagnosed with TB to treatment, but probably have reasons not to be taking it as regularly as our speakers did mention, strengthening retention of people who are taking TB, and strengthening the TB prevention. Colleagues, we must also be very mindful. I was taking treatment for flu last week. As usual, I never finish what the doctor asked me to do. I take treatment for 8 days because I feel better. I then don't finish the 2 days. You can imagine if I was on treatment for TB, if I am not able to finish just 10 days, and we are asking our patients religiously so to do 6 months. So it means we need to actually continue to say, I did have a support at home. They were asking me, "Are you on treatment?" Yes. "Had you taken this morning?" And then I lied. I said to my wife, "Yeah, I taken the treatment." So you see, I'm not a very good patient. Now, we require our patients, our clients to keep on remembering that they have not taken the TB treatment and they must be supported for 6 months, and some of them beyond this. So we do have in this TB recovery plan a very clear knowledge that it is a transitional plan that will lead us into the National Strategic Plan of 2023 to 2028. We therefore need to accelerate this TB recovery plan, DG, and make sure that you champion all of us to move on this part. I must also mention that despite South Africa being the TB-burdened country, it is also a home for a critical mass of well-renowned scientists. Professor Hanekom, we are grateful that you have here, and we have assembled a lot of scientists, researchers, experts. And some of us sitting here, yes, had that background of being clinicians, but now are sitting on the other side as policymakers. We look up to you, we look up to the information that is going to come in here and support us so that we too can make policies that are actually informed by science. Most of what one says here is what you colleagues have educated us about this. So South Africa's TB response is also internationally admired, scientifically, because of your contributions. The scientific excellency, steady decline in disease burden, and early adoption of new technologies such as molecular diagnostics and short-term regimens is what we really get advices from you. So that's why we can sit back and always rely on ministerial advisory committees. So you have done exceptionally very well assisting us as scientists in the country, even on COVID and other programs. Do realize that this one too will need your continuous guidance and support to us, and all that we say is something that you have advised us. We are grateful to learn that you will have 4 tracks in this conference that will provide a wonderful opportunity to participate, and I've screened through the program myself and I see where I'm going to be, because track 1 will cover the pathogenesis of TB. It's those people whose brains are still very young who wants to go there. Track 2 will be about drugs, about vaccines, about diagnostics. This morning I was actually saying, yes, we are able to get vaccines for COVID quite faster. Why are we struggling? Why are we struggling to get a vaccine for TB? Why are we struggling to get...
All right, that is the Deputy Health Minister there, Dr. Sibongiseni Dhlomo, officially opening that TB conference that's currently underway in Durban. We'll certainly be covering that conference for you here on SABC News.